Good afternoon, everybody. It's about 3:05, so we'll go ahead and get started. We've got a couple of people still filtering in, but we're got about 50 people right now who have joined the call. So my name is Joe Benish. I'm the owner of the Ingenuity Company. I'll be facilitating the discussion. But before I do that, I wanted to turn it over to Sheila and Jennifer to make some announcements before we start.
Good afternoon, everybody. I'm Jennifer Chittenden, the Executive Director with the Des Moines Downtown Chamber of Commerce. My first call to action for you this afternoon is to put your mics on mute. If you're not currently speaking, go ahead and do that. That'll cut down on the feedback so we can hear our speakers later on in the presentation. There is a chat box available, of course, for conversation as well. A little about Downtown DIG. It stands for Development Insight Group, and it was created in 2015 to promote discussion and to get ahead of what's being talked about downtown. Today is just as timely as ever, and I'm really proud of the DIG committee for putting their heads together a few weeks ago and coming up with this concept and reaching out to get our leaders from Polk County in front of us today. I just want to take a moment to acknowledge the people on the DIG committee, and when you see them, please thank them for their foresight. Ben Butsky, Scott Meeker, Ryan Moffitt, Dan Corin, Carrie Boyens, Susan Judkins, Matt Weller, Joseph Dickinson, Nick Aldrich, Nathan Scott, Elise Feldman, Zane Muntz, and Jeff Magner, who you'll hear from in just a little bit. Again, there are many businesses locally who support the Downtown DIG series. They've been part of it and continue to make this available to you at least once a month, if not more often than that. I want to also take just a moment to acknowledge those businesses that support the series and make this information possible for you today. Our presenting sponsor is Terracon, and you'll hear from them in just a moment. And our gold sponsors today are the City of Des Moines, the Office of Economic Development, Ripma Properties, Mid-American Energy, and the Iowa Architectural Foundation. The Downtown DIG series is also supported by American Marking, Confluence Inc., Epix Studio, Hanson Company, Newman Brothers, and Tri-City Electric. We're really proud to have the support of our DIG committee and all of our sponsors. And I also saw that our current president of the Downtown Chamber Board of Directors, Sid Jawarkar, is here with us today, also representative of Terracon. So I'm going to turn it back over to Joe Benish. And if you weren't aware of this, Joe is a past president of the Downtown Chamber Board of Directors. So back to you, Joe.
All right, thank you. Then thank you, Jennifer. Yes, if you wouldn't mind, just as a reminder, just mute your mics as folks are talking today. If you do have questions, either type them into the chat window, or you can use the raise your hand function, or whatever you can do to get my attention to make sure that I'm happy to read the questions to our panelists, or you can go ahead and do that if I can unmute you, or you can unmute yourself. So just any one of those is fine. I'm sure you've all been through this format a few times now, so typing them into the chat is a good way to ask questions as well, so I can help you with that. We have three panelists today. I'm going to let them introduce themselves, but the format for today is we'll just go in order. AJ will start, then Helen, then down to Supervisor McCoy, and each panelist will have 10 minutes to kind of talk a little bit about the developments, what's going on, kind of what their role is, what they do, how they interact. As they're talking today, what I'd like you to do is think about some questions you'd like to ask them. We do have some seed questions, but given the tumultuous nature and sort of the ever-changing circumstances around us, we thought it'd be good to have the people who are on the Zoom today to kind of generate some of the major questions. So if you wouldn't mind just kind of giving some thought to that as we kind of go through that. So with that, I'm going to ask AJ Mumm to talk a little bit about setting up emergency operations and sort of what their plans are moving forward. So with that, AJ, take it away.
Thank you, Joe. And also thank you to Susan for reaching out to us and making the connections there. In addition to Susan, there's a lot of other familiar faces on the Zoom here. So good to see everybody. Glad to be with you, and thanks for the invite. Joe, we sent along some slides. I'm not sure if you're able to pull them up. I can talk without them if we need to, but might be a little easier to connect if you have an opportunity to get those slides up.
I do. Give me just a second, and if you wouldn't mind, just tell me when you're ready for me to advance, and I will push those forward. Okay.
Wonderful. Thank you. All right, as Joe's pulling those up, started with a timeline, and I think it's important to look back at how this all came to be. And we first heard about what wasn't even called COVID yet on November 17th on a out of Chinese media report, and it wasn't until January 30th that the WHO declared the global health emergency. And one day later, and this is in partnership with the Polk County Health Department, emergency management met with the local health department here, and started to talk about what this might mean if what those reports out of China were accurate, and if they started to arrive here in the United States. And what that resulted in is a somewhat of a, what we thought was, well, it's prudent, but we might not have to do much with it, but we wanted to be prudent. So we asked all of our response partners, mainly the healthcare systems and the Central Iowa EMS directors, to begin by just doing a simple inventory of their personal protective equipment. Because we had distributed a lot of PPE over the years for a variety of things, a variety of other diseases, and some of that PPE had expired, quite honestly, and we were starting to have questions about, well, can we use this if it's expired, and so on and so forth. So started to work through that in early February. On February 5th, with the quarantine on the cruise ships, started to be front and center in the media. And it was on February 26th that Helen and I met with Supervisor McCoy and talked about what this might mean to us, to local government in general, to all of our response partners, and started to lay out a phased approach. And by March 6th, we had established basically what we thought to be a three-phased response process, that we would do what we can to get ready, to prepare and monitor the situation, and that expecting that we could be a hotspot, that the disease would eventually arrive here in Central Iowa, in Polk County. And so what were going to be our steps once we're here, and that Helen can get into what all of that means, but we started talking about that, and as an expectation that we're likely going to see community spread at some point. And so that was all back on March 6th. March 8th, we saw the first case here in Iowa. I believe that would have been probably a Sunday, because on March 9th, I believe it was when we first officially opened the Polk County EOC, and we've basically been going full-time every day since then. At least some portion of our EOC has been active every day since then. And it wasn't until March 17th that that COVID was now present in all 50 states. Joe, if you wouldn't mind advancing the slide, please. A lot going on here. I'm not going to go through each and every one of these pieces, but to give you a sense of that this is definitely a team effort. There's a lot of collaboration, a lot of organizations that are leaning into this and have been for a long time. Helen's done an excellent job, outstanding leader in being the incident commander. Proud to support the operations part of that as the operations section chief, but Helen and I have a lot of people that we work with every single day that you see on this chart. And we operate under what's called an incident command system. It's really mandated under the National Incident Management System, which came out of 9/11. These types of organizational structures have been used in the military, in the fire service for decades. And so it serves us well no matter what it is. We have a very similar organization for flash flooding that we did in 2018, for smaller scale stuff like hazardous materials, apartment fires, you name it. There's an organizational structure. It isn't always this populated. There's not usually this many boxes on there, but you can see that we break that down by operations, planning, logistics, finance and administration, and in this case, recovery, which I believe Supervisor McCoy will talk more about. So you can go into the next slide, please. I have the honor of being the operations section chief, and the real hard work is done by those at that group level. They're really the subject matter experts. They're the ones that are digging into and getting their hands dirty on a lot of different stuff with whether it's the public health group, which they're doing, the traditional high intensity public health items like surveillance and investigation, tracing, monitoring, persons under investigation, testing. Helen might touch on sort of how that's transitioned over the last few weeks, but they're still doing a tremendous amount of work, really putting in hours and hours and hours every day. Our medical group under Franny Medeiros, Franny's leading a group of representatives that we call the Medical Coordination Center. This is made up of all of the hospital systems here in Central Iowa, as well as the Polk County Health Department and Central Iowa EMS directors, which are 20-some EMS services that provide that frontline pre-hospital care. And then also 211, which I'll talk about in a second, how they're tied in here. Eric Kuhl from Polk County Community Family Youth Services, really just a tremendous person, leading a great group on dealing primarily with the homeless. And there's just a very complex series of assistance and coordination that they provide. Our traditional first responders are represented by Chief Chad McCluskey. Chad's the police and fire chief in Windsor Heights, and he has been gracious of his time to represent and communicate all day, every day with Polk County law enforcement executives, Polk County fire chiefs, Central Iowa EMS directors, our 3 public safety answering points, our 911 centers. Dr. Akers is our Polk County medical examiner, his representation there into the mass fatalities group, and then Liz Cox as the executive director of the Polk County Health Services. Again, Liz reminded us very early on, and we're happy she did, of how important mental health is in this entire process. And also involved in this is Lynn Murray. He's a retired major from the Des Moines Police Department, now with Pleasant Hill City Council, and has a very keen interest in dedication to critical incident stress management and making sure that our frontline responders have that care that's needed during these kinds of events. Next section, please. The recovery section, I'll save this because number 1 on time, and number 2, I think Supervisor McCoy will cover a lot of this. Next slide, please. So that organizational chart that you saw is all there to support the execution and hopefully successful implementation of 16 objectives. We do all of our business on what's called management by objectives, breaking down big problems into smaller problems, and we continue to do that until the problems are small enough that they can be addressed, that we can assign them out, and they can be resourced. So the way we do that is saying, what needs to be done? What do we want to accomplish? Those whats are all here in this list of 16. Actually, there's 15 active. Number 7, which was one of the first ones we worked on, but is now largely completed, which was repatriating those that were traveling abroad as they mostly returned from those cruise ships. They were assessed once they made landfall. Some of them were distributed to various parts of the country in isolation shelters, and then the governor made it very clear that one of her first priorities was to get them home, and we helped support that through their arrival here in Des Moines, and then getting them home and minimizing the interaction that they had with people along the way. But otherwise, you can see here, first and foremost was to protect the public. And Helen can talk a lot about that. Protecting those healthcare workers, again, that's Helen's done a great job of leading her team in doing that. We have a joint information center. Nola Agner Davis, has been our joint information center point person, our public information officer, and really a really tough job of trying to manage this amount of information, this amount of sometimes conflicting information, rapidly changing information. So that's been a challenge that she's done a great job meeting. Number 4 there with again, just distributing information to the hospitals, to EMS, to other first responders is a daily responsibility. I mentioned the Medical Coordination Center with the hospitals and EMS and public health. because this is, you know, it's a novel virus, there's a lot of first times. And with a first time comes all of the legal considerations. So the Polk County Attorney's Office has been outstanding, turning around tough questions with great advice very quickly back to the Emergency Operations Center. So we appreciate their participation. Skipping down to number 8, you know, the mental health pieces I've talked about and how important those are. Number 9 is the volunteer coordination. This one's a little bit unlike our floods and windstorms and other things that we've had, because usually there's, you know, some amount of debris that needs to be picked up, cleaned, the community cleaned up, you know, putting stuff back in order. And that's really not the case with a disease like we're dealing with. And so the volunteer management, we still have a lot of people that, and it's not a surprise to me, and it's probably not a surprise to anybody else on this call today, that how engaged our community is and willing to help out. And so wanted an avenue for them to help out. United Way of Central Iowa and Volunteer Iowa were natural, you know, they do this every day. And so our job is mainly to connect those that were willing to volunteer with those organizations, and then work with United Way when there are volunteer opportunities to ask them to do their work. And so far that's been a lot of things like making cloth masks, and we've had some great response to those requests. Donation management, I'll talk here in a second on one of our slides just on the logistics donation of supplies. It's been a great thing. Our logistical support, again, I'll cover some more detail here in a moment. We want to make sure that under the fiscal management objective number 12, that you know, we're still stewards of taxpayer dollars and cents, and we don't take that lightly. And so making sure that we're doing this in a cost-effective way as possible. But again, no secret, there's just a lot of, there's cost to doing things like this, and we want to make sure that we're justifying those costs with exactly what you're seeing on this screen. So every time that we have a cost, we can tie it back to what is the purpose of that effort, i.e. an objective, what strategies are we doing, what resources are required, personnel, equipment, supplies, and then relating those costs back up again, connecting them all the way back up to these objectives. And that type of documentation is critical when we're dealing with FEMA. Again, so as we send those tax dollars up to our federal partners, they are requiring a lot of documentation, and we want to make sure that everybody knew that on the front end, that if you're experiencing costs, to track those costs allows us the best opportunity we can to get those costs reimbursed by our federal partners. You know, a lot with creating additional physical distancing at our homeless shelters meant that we utilized vacant hotels and hotel rooms. And so again, with the support of the Board of Supervisors, able to work with the homeless shelters, create a little bit more room in the homeless shelters, so that if we did have a disease, the virus that was introduced to a homeless shelter, that it would not spread as quickly or to as many people. And so we have several strategies that are designed to mitigate that. And so if you've heard or seen the voluntary isolation shelter at the Iowa State Fairgrounds, that's all a part of that process. Again, Dr. Akers, with our medical examiner, talks to us every day about trends he's seeing, suicides, overdoses, all of those. Again, we're connecting back to the rest of the people on the team, making sure that if we're seeing a trend in one side of our team, maybe with suicides or overdoses, is there a connection, a nexus back to mental health, and what can we do to minimize those mental health impacts? So that's how all of those are related. And again, our recovery plan is going to be what moves us from this response phase into making sure that this whole incident gets stabilized, and we build in some resiliency and on our way to getting this growing community back on its feet and growing into the future. So the next slide, then I should be done. I wanted to put this up here just because, number one, our logistics section is working their tails off every day, and pretty impressive numbers here. You know, again, it might not have something to relate it to, but trust me, on a lot of other disasters, when we're a couple 100,000 sandbags is a major flooding disaster, when we're dealing with hundreds of thousands of units of masks, gloves, gowns, face shields. There's a lot of stuff moving through our logistics section every single day. And early on, we wanted to make sure that we identified a clear, transparent prioritization, because there are going to be some that receive what they ask for. There's going to be others that only partially receive what they ask for. And then there's going to be others that ask for stuff that we just can't support. And so having a very clear, transparent list of priorities based on what these organizational missions are was important for us to get out early. We did that. And you can see there on the bottom right, this is just the number of organizations. 60 plus congregate care facilities. These would be the long-term care centers, the nursing homes, et cetera. The other parts of the list are pretty self-explanatory. The medical providers would be the hospitals and clinics. Sometimes the numbers are a little bit deceiving because for example, nonprofits, it says 8, but what we have happening is we have certain nonprofits that are receiving and distributing PPE for a number of other nonprofit organizations. So the number you're seeing on the screen is definitely underrepresenting the complete number of nonprofit groups that are being assisted. We have a single point of contact that we work with, and then they take it from there. So, and nearly 150 organizations, and we expect that number to continue to grow. But I want to end on just the gratitude we have for the private sector and private industry that have donated more than 250,000 individual items to our effort. And those are what you see there: masks, gowns, gloves, etc. Cloth masks would also be an item that they've donated. And I tell you what, without that 250,000 units of donated items, we would have a very, very tough time surviving what I call droughts. We have sort of a peak and valley between the availability of personal protective equipment, and these donated items have been, it has allowed us to sustain operations on a more steady basis. So without that, we'd be in a much more difficult spot. So I'm sure I've taken probably more time than I should have, but a lot going on. I wanted to give credit to everybody on the team that is doing so much. It's not just emergency management. We have the privilege of coordinating on behalf of dozens of other organizations. We manage the Emergency Operations Center here, but we're basically just, we occupy the building and make sure everything works and get people together. But it's all of those other entities that come together to make it really a high functioning, high dynamic team. So thanks again.
Thank you, AJ. That was extremely well presented. Really good information there. Supervisor McCoy is going to talk about the policy decisions along the way and kind of some expectations moving forward. Sorry, Helen, we'll come back.
Sure. Joe, go ahead and throw up, if you would, my Polk Recovery Partnership slide. Should have been sent to you. Do you have that?
Yep, hold on just a second. I'll get it up there.
That's great. So Matt McCoy, I had this year of serving in the capacity of board chair, and I started effective January 1. So about the time all of this really started to come to fruition. And so one of the things that we knew right away was that this was unlike anything we've ever dealt with before. So we've been front and center in Polk County in a variety of ways to serve our community. And we're reluctant to really begin the talk publicly about recovery when we're still surging in Iowa, and specifically in Polk County. We're looking at our numbers, and it's hard to talk about recovery when we feel we have so much improvement to make in our entire system right now. But we've begun the process of working collectively with the Greater Des Moines Partnership and Their program is called Des Moines Forward, which is to address the economic impacts to the business community that the closures created. And so our goal is to partner with them as they've enlisted Baton Consulting to help do an analysis on what the business community is looking for in the way of guidance and bringing back their workforce. So we focused on the health area, and under health, that would include the physical health of our residents, the mental health of our residents, and then the public health of our residents. And you can see a listing of all the partners that have been asked to participate or will be asked to participate in some capacity under the health footing. And in addition to that, we believe that you've got to address the basic needs of your community, and that's your housing, childcare, school and childcare, food recovery, food pantry, food shortages, addressing those needs, as well as the financial security of individuals. And obviously, we're partnering with United Way and Children, Families, and Youth Services as well. And what we're trying to do is put together groups that fall under this category that definitely have needs. Our more vulnerable residents, our senior citizens, our refugees and immigrants that are new to our city, state, and county. The impact of community action partnership and Safeguard Iowa partnership, legal aid, and the continuum of care for child care. And one of the things we found out right away, just with our own first responders who were asked to work 12-hour shift, is you can't get your workforce back until you've addressed your child care needs, and your child care needs are really a priority. And so we've been working with some organizations. Some child care centers have operated throughout the pandemic. Some child care centers have shut down and moved to a private system. But clearly, people are still working today, and people are still using childcare today, and we know that's an important part of from a strategy standpoint, getting our workforce back together. So as I noted, again, our recovery program will focus on the needs of the community, the nonprofits' basic needs. And that's why we've suspended our Polk County Grants program that we run annually with Prairie Meadows proceeds. We do have funds that are not expended yet, but we're directing all of those funds to human services needs. So think about food recovery, general assistance. We've expanded our definition for general assistance to 150% of poverty so that individuals can apply for rent assistance, utility assistance, child care assistance. We really want to make sure that we have the funds to help people meet their needs during this short term, what we hope will be a period of unemployment, and we hope there will be a full return to work for most Iowans, but we know that's probably overly optimistic given what we've learned about closures of many businesses. As a response to our efforts, we've also been working with the Community Foundation. The Community Foundation, United Way, and others had begun meeting to discuss building a community disaster recovery fund with the thought that we would be prepared for tornadoes or for floods. We didn't know when we were first getting these meetings started that we would be up and running so quickly with our own disaster being this pandemic. That fund has raised just under $1 million, and the funds are being used to help meet the basic needs of the community's most vulnerable residents. particularly those that are not able to meet other federal, state, or local resources. And we've used the funds to support our emergency food bank system. We've worked very closely with the Moines Area Religious Council, as well as working very closely with the Food Bank of Iowa, trying to make sure that we have a steady supply of food, meat, dairy, produce, to supply enough food for families during this pandemic. In addition, we have also participated in the Small Business Grants Program, and this program was really put together by Polk County and some of the local member governments, Urban, West Des Moines, and others that have participated. And it provide assistance to people that wouldn't otherwise qualify for SBA assistance. And, you know, a lot of the ways that we're thinking about this recovery is we know that the things that we're doing today are short-term help for the community, but we know that there's going to be other long-term needs that will identify themselves as we start working the problem. And again, we need feedback from businesses. We need feedback from small businesses that are trying to figure out how to reopen and what opening will look like. And obviously, we want to talk to the community in a collaborative way about how to support them with those human service needs, like the child care. What happens if we're not able to start school in the fall, or what happens if we start school in the fall and a second wave of the pandemic comes through? What will that look like in the way of school and child care and closures and not having closures? So those are all issues that we're going to be wrestling with. And I'd like to say we have all the answers. We don't have all the answers. We're very fortunate to have AJ Mumm leading the team with Helen, Eddy from the health and human services side, from the mental health, Liz Cox taking care of people's mental health, critical in the pandemic. And people have really been exposed to, and especially our children, have been exposed to a lot of trauma throughout this pandemic, and they've heard a lot of things that are quite frankly scary and frightening for them. So we need to address those children's needs, mental health needs, and well-being. So we know that this is a long-term recovery process. This is not something that's just going to happen, that it will take anywhere from 12 to 18 months before things start feeling normal again. And until we have a vaccine, we know that it's going to be hard to declare mission accomplished in the way of recovery. And I think that kind of sums up what I wanted to cover. And I would love to hear from Helen now if her video is working.
Can you hear me now?
Oh, yes, we can hear you now. Absolutely. Oh, we lost you again. While we're waiting for Helen to rejoin, do we have any questions that Matt or Matt McCoy or AJ could take care of while we're waiting for Helen to log back in? One of the initial.
Joe, I have one for Matt.
Yeah, go for it.
I was listening to the Polk County update this morning, and I heard you reference that you don't plan to open any Polk County facilities until at least July 1st. Can you tell us what your thought process will be on when you do choose to open?
Sure. So the important thing to remember, and I appreciate the question, because one of the things we decided early on was that Polk County would remain open to the public, but we would change the way we do business. So ultimately, our front doors are open. We have one set of doors where people come in. They can still do all their business that they want to conduct with Polk County, but we're doing more appointments and more business by appointment. People are dropping off their checks for their taxes. We still have people that like to pay their taxes in person, like to bring their check down to Mary Maloney and write the check themselves. And so most of the things we've moved online. And so there really isn't a lot of need to have people in the building. We are bringing plates up every day and stationing a person at the treasurer's office that will have people's plates that we've notified and said, come pick up your license plates. And so our goal with opening July 1 was to protect the health and well-being of our employees. And we feel that we have reason to believe that we're going to be continuing to experience surge through the month of May and maybe into the first week of June. And so therefore, we wanted to allow time for things to flatten out. And we thought that it would be more appropriate to be looking at a July 1 opening. And again, every person that comes in will be required to wear a face mask, and every person will be temp checked on the way in, including all of our employees every day. Our employees will be in face masks and they'll be temped every day as well. We know as safe as our frontline workers. So that's what went into the July 1 opening.
We did have a question in the chat from Barb. How long will the property tax abatement last, is the question.
So the property tax abatement will last till July 1. And then, you know, we'll revisit it if the governor revisits that. The governor did that through proclamation, and so we'll take a look at it at that point if it's extended.
Another question that was, we sort of have a list of questions developed given some of the things that have happened recently. Could you or AJ talk a little bit about the spike in cases in Des Moines that made the national news today and kind of what the reaction to that is?
Hi, this is Helen. And
Hey.
hey, so one great thing that we have here is that the Polk County Health Department and Emergency Management are co-located. So if my computer's not working right, I just run over to AJ's side of the building and here we go.
I'm so glad.
So it's low tech, but it worked. So I just ran across the building. You know, I think what we're seeing is not surprising. I mean, we've been tracking and watching our numbers. We have had a number of outbreaks in businesses, manufacturing facilities, packing plants in counties that are around us. And knowing that a number of those employees reside in Polk County, we've anticipated this going to happen. I mean, there's a 14-day incubation period after exposure, and this is highly contagious. So as we shared in our briefing this morning, our numbers are increasing. Our case counts are increasing and our hospitalizations are increasing. So someone wise sitting next to me has said, you know, you don't know you're at a peak until you're past it and you look backwards. So we don't see our peak yet. We're seeing continued sustained high community spread. And so the word to everyone is all of those mitigation techniques that we talk about that don't seem very exciting actually work. And those are the tools that we have today. Stay 6 feet apart, wear your mask, wash your hands, stay home when you're sick, social distance, all those good things. They're not fun, but they actually work.
Thank you. Helen, would you like me to fire up your slideshow? Would you like to give your
Sure. I'll just go through it. I'll just go through it quickly. I have 3 slides to share, and a lot of great information's already been shared, so I don't want to be I won't be redundant, I hope. as Joe's firing that up, really, when I look back on our response, I kind of broke this into, there are a couple of buckets that this seemed to fall in. And early on in the response, as this pandemic was emerging, was that we really had a need for credible public information. How did we get the right information to the public? How did we not stoke fears and panic in the community, tell people what they needed? So one of the things that we did very early on was establish the Polk County Health Department website as a hub of that credible local information. And we've continued to maintain that and update it. And really addressing rumor control. As soon as we would hear a rumor, we would research it and try to get that information out quickly via our website, social media, and to our partners. Another thing that we did, and I know AJ touched on it, was 211, and establishing that and embedding health professionals in addition to the normal 211 staff so that we could triage questions from the public about, am I sick? What are my symptoms? Do I need to be tested? What we did not want to have happen would be having sick people showing up to emergency rooms and exposing other people, or just showing up to clinics. And if you're on our call this morning, this has been tremendously successful in our community and continues to be a resource that people use to really triage their health before they make that phone call to their own provider. Another thing that we did very early on was around unifying our messaging and conducting town halls, and we did 3 of those. First, about just medical questions with members of our medical coordination center. We held a mental health town hall, and also one on financial well-being. These were all questions that were emerging from the public, and we wanted to make sure that we had a way to get this information out there broadly. Next slide, please. I always remind myself that all of the things that we are doing in this response to COVID-19 is really to coordinate, support our healthcare system. We do not want to overwhelm our healthcare system and our hospital system, and want to make sure that the people who really need it can get the help that they need. And AJ touched on the creation of our medical coordination center. It has been wonderful to see the relationships that have developed among our healthcare systems and the sharing of information and coordination that they continue to do. It makes it very easy for us if we have a question that comes up about someone struggling to get care somewhere, or maybe some misinformation, to get it back through that system and get it corrected. We continue to monitor daily the hospital status. Again, our goal in all of this is to make sure that our healthcare system can support the people that really need it. And examples of some of this coordination really around common policies and messages. Very early on, our hospitals came up with standardized visitor policies. You've seen in the last week that they're all requiring masks of people who visit the hospitals. And you can imagine the confusion that might happen if one hospital system was doing something differently than another hospital system. Their testing protocols are unified. Again, you can't go to one system and get a test and then, or get turned away at another system. They have standardized testing protocols. And then the biggest legacy coming out of this work has really been the development of plans that will last well beyond this pandemic, that allow us to handle hospital surge. What are we going to do in case one hospital starts to be overwhelmed? How do we move patients? How do we move patients out into the critical care hospitals and still maintain the health of the entire health system? Next slide, please. Our public health response, I'm just going to touch on this briefly, but really in a situation where we don't have a lot of the tools that we would like, we're in a situation of scarcity, scarce PPE, scarce testing, there's not a cure. What we are left with are tried and true public health strategies that include that mitigation, which I won't read to you, but those are things that work. And I always say they're not sexy, but they work, and they're what we have. And we're going to have to learn to stick with these for the next 12 to 18 months until we have some other tools in our toolbox. It's also been about case management and contact tracing. We have a team of nurses here that are our communicable disease team. And early on, when our case numbers weren't high, these are things we do every day with all kinds of diseases: measles, pertussis, E. coli, salmonella outbreaks, where we contact patients that test positive for those things. We interview them. We do contact tracing, find who they were around, chase that down. We do some case management where we make sure and contact them and make sure that they're staying well. And then in the case of this particular thing, we also then will monitor when people can be released and when they're able to release from isolation. I will tell you, with the volume of cases that are now coming into our state and into Polk County, this is something that we turned back over to the Iowa Department of Public Health. Not enough staff available and not enough staff for us to be able to hire. And so we turned those cases back over. But instead, we are focusing now our efforts here in Polk County on working very closely with our congregate living facilities. That includes long-term care, assisted living, shelters, etc., because that's where we have some vulnerable populations. So we're working closely with them, giving them guidance on how they can mitigate and try to prevent the spread of infection inside their facilities. We've done a lot of work with elders across our refugee and immigrant community to share the correct information with their constituents and their populations. So our work is focused there. We are working very closely with any of these congregate sites in Polk County that have cases, not just an outbreak, but have cases, trying to prevent it from becoming an outbreak status, because that's, we feel, the best use of our expertise and resources at this point. And with that, that's the end of my slides.
Thank you so much, Helen. I'm glad we got a chance to hear from you. Questions for the group, either in the chat window or we have one from Matt Cohen here. What percentage of cases in metro hospitals are from outside of the metro area?
I don't have the exact number of what's from outside the metro area. We really monitor our hospitals in two ways. We monitor directly the number of COVID hospitalizations that our hospitals are seeing here, but there are also developments of regional numbers. You'll see on the Iowa Department of Public Health site that they have broken the state into 6 regions. We are in RMCC 1, and that's really an indication of knowing that hospitals from outside of Polk County feed into Polk County. So the numbers are reflected there. I've not seen a number of exactly what county they're coming from, but our monitoring is inclusive of that.
Excellent, thank you. Other questions? This is a question from Creighton Cox to Supervisor McCoy. How is Broadlands doing financially, and will they need additional support coming out of this pandemic?
So Broadlands is doing fine. Financially, they were doing fine prior to the pandemic. One thing that has created some challenges for them is obviously elective surgeries were suspended during the COVID outbreak, which impacted their revenue significantly. And it appears that under the CARES Act, some of that loss of revenue will be reimbursed by the federal government. And I think there's a desire to see what will come of that. And but ultimately, they're in a strong financial position. I believe they will come out of this as strong or stronger of an organization in our community, as a community-based hospital with a levy system that is currently not tapped. And so I think they're going to do fine. Thank you.
A question from Dan. Messaging has not been consistent on wearing masks and social gathering. I want to get over this as fast as possible, and that is only going to happen if all people do the right things. Should all people reporting to work be wearing masks? What are we to do if we see people not respecting the social gathering guidelines? Well,
I think what we need to all do is set a good good example. The recommendation is that if you can't maintain social distance in certain areas, that masks are recommended. I think you heard Supervisor McCoy say that in county buildings, we're going to require people coming in to wear masks. We wear masks here at the Polk County Health Department and Emergency Operations Center when we're together for that protection. So you should be wearing masks if you don't feel that you can maintain social distance. And I remind people that I think it's good to remember too, that masks protect you, particularly if you're one of those asymptomatic positive people, from sharing it with others. And there is some protection also to you for wearing it, but it's really a preventative thing in case you're asymptomatic. So it's a good idea. In terms of, I guess, what do you do if you see people that aren't social distancing? You know, ask them nicely, remind them nicely. We can be polite. We're Iowa nice. I think sometimes it's easy for people to, it's easy to forget. Sometimes I had Mother's Day with my mom, and we stayed apart. We had masks. We did things. We were outside. Yet she couldn't hear me, and she kept wanting to get closer to me, and I kept backing up and having to tell her, Mom, you know, we've got to be 6 feet apart. It's hard, and we have to really continue to try to do our best, because as I've said, those are the only tools that we have to really help prevent the spread of this.
Well, and sorry if I interrupt in this way. You know, I don't want to overburden our police or anybody else that, you know, in typical situations of distress or wanting to alert authorities, you know, you would typically call the police and let them know of the situation. If we see a neighbor, if we see a business, if we see somebody that's really not abiding by those guidelines, should we be contacting the Polk County Sheriff? Should we be contacting local authorities, or what's the guidelines on that?
Well, I think that what we hear from our law enforcement partners, and AJ, if I'm misspeaking, step up. But, you know, I think the most that they would do is drive by and ask people to break it up. I mean, I don't think that in this situation that they really don't want to be picking up people and incarcerating people and putting people in the Polk County Jail for something like that. I mean, again, that's a congregate living facility. We know we have cases of COVID in the jail. They're going to politely ask people to break up. And I think what we're hearing from our law enforcement partners is that when that happens, people are respecting that and doing that. So if you're talking to them doesn't help, you know, then law enforcement would drive by and say, hey folks, break it up. And that usually seems to take care of it.
I just would, before we get to the next few questions, I just want to point out that, just to be fair to everybody's time, we're almost right at 4 o'clock, and with the group's permission, we've got a couple more really good questions, so we can continue on. For those of you who have to depart, you know, thank you for your time. Thank you for being here. This has been such a good discussion. I just want to make sure we can keep going just a little bit. So with the panelists' permission, you know, if we could just steal another 10 or 15 minutes of your time, we'll keep moving forward. And if you have to drop off, then please do so. But I want to say thank you to everyone before that happens. So with that in mind, I think one of the big questions that's come up, and we were talking about a little bit earlier today, is, you know, what are your feelings about lifting the restrictions in Polk County? Is this the right time to do that, given the national news, or is there other thinking on this, or what are your feelings on that? Any member of the panel?
This is Helen, and I think one of the phrases I've heard from leaders across various sectors in Polk County is that we're taking a cautious approach. Our businesses are taking a cautious approach. We know that anything that we do, we need to still have people's safety in mind, and so we have to be able to do it safely. So, you know, just because you can do something doesn't mean you should do something until you can do it safely, which means ensure social distancing. Do you have appropriate PPE available for people, and wearing of the masks and all of that? So it has to be done in a thoughtful way. We're watching the numbers, and we're seeing increases in cases and increases in hospitalizations. So and we share that with the public so they can use that in their decision making. Supervisor McCoy, anything you want to add to that?
No, I think that's the right approach. I think that what we're hearing consistently when we talk about recovery from businesses is definitely a measured approach. We want to be measured in how we approach reopening. Obviously, people want to protect the place they want their business, and they want to protect their customers. So I think that businesses are trying to gauge that, and because we've never been through this before, I think there's going to be some dialogue, and I think they're going to be really responsible people out there, and I think a few out there that'll without a lot of regard, and I think they'll see whether that works for them. I think there'll probably be consequences to not being measured.
We had a question submitted from Barb. A lot of federal funds for hospitals went to hard-hit areas before the wave hit Iowa. Will funds still be available for the Iowa during the peak?
Yeah, from what I can see, Iowa's going to have its share of resources from the CARES Act, and I know that there's a fourth version of the CARES Act, which I've had an opportunity to see a marked up House Democratic caucus copy of. What I will say is that the state of Iowa has received $2.2 billion without a terrible amount of guidance. And those funds were directed for cities that are in excess of 500,000. So since Iowa doesn't have any city in excess of 500,000, the legislature is really going to have to make some decisions about how those funds should be used. I know there's going to be an effort to address rural hospitals and some of the challenges that they've had through COVID, but also urban hospitals and urban healthcare centers that have experienced a downturn in elective surgeries, which has impacted their revenue.
Other questions? There's a question from Naomi here. Could you talk about the importance of HVAC systems when returning to places where many people will be sharing the air, even if it's 6 feet apart, such as restaurants and offices?
I've not seen anything particular to HVAC systems, although you know, what we do recommend when we're working with some places where people are close together, you know, the more you can do to improve and circulate airflow, that helps. We even talk to people that are living in crowded living conditions about opening windows and all of that. Again, if you're more than 6 feet apart, the virus can't travel that far. And if you're more than, as you're 6 feet apart, the chances of that are small. I would have to do some research on HVAC in particular and get back to you, Joe. I just, you see, I can't even run Zoom. So, you know, mechanical HVAC, it's kind of out of my wheelhouse.
Well, and we had a wonderful dig a few weeks ago that was more specific around that. That's available on the YouTube channel. So they had a lot of really good information from mechanical engineers and stuff on that. So I think that you're off the hook, Helen, on that one.
Okay, I'll look that up.
Okay, very good. Last question here as we kind of move forward. So how concerned are we about a second wave of the virus once we're opening up more and more? Is there a contingency plan in place for if and when that happens? Or what would we have to do if that happens?
Well, we are very concerned. I'll say that. You know, we anticipate that we are likely to have a second one, given the fact that we don't have vaccine and other things. I know I sound like a broken record. We know the tools that we have, and I won't run through the list again. That's what we have until that happens. Also, I think that what you'll see, and AJ's touched on it, that in a typical response, you kind of pick up the pieces, you get it all put back together, and you go home. We know what this is going to ebb and flow, and so we're constantly analyzing where we are in this process, what parts can we stand down to a degree and then be ready to reactivate quickly. What I do want to assure this group is that all of our planning has been how we can be flexible and how we can respond. And much of what you've seen and hear about coming out of our planning processes with our healthcare systems and all that are things that we expect that we will revisit and that we will reuse and will continue to fine tune. So I know it's not fun to hear, but we're going to be with this for about 12 to 18 months. And we know that we have to be prepared to respond at any point in time through that. Now, one of the messages I think you'll see us pushing out are some things, again, beyond just mitigation that can help with a second wave. A lot of concern about kind of the clash of seasonal influenza and COVID patients at the same time. So I'm going to put in an early plug-in commercial for get your flu shot, get your flu shot, get your flu shot. Again, that's one of the things that we can do that will help our community should we see another wave of COVID virus in the fall.
Excellent, thank you. Well, with that, I want to thank all of our panelists for being so generous and going a little bit over time and doing such a great job with the presentation and going through such great information. I'm sure any one of them will be available for further questions after this. But just want to say thank you. From a facilitator standpoint, this has been great. So I appreciate everyone's time and commitment to this. I have been recording the session. I will edit it and make it available through the Chamber's YouTube channel. But I want to say thank you to Susan, Jennifer, Sheila, the DIG committee for allowing me to do this. Again, my name is Joe Benish. I own the Ingenuity Company, which is a strategic planning and organizational development firm. So with that, I'm going to turn it back over to Sheila and Jennifer to kind of take us home. So thanks, guys.
I'll just jump in here really quick and just echo what everybody's already said. Thank you so much to Joe and to Susan and the entire DIG committee on doing a lot of the legwork on putting this together. Thank you very much to the Polk County officials here today that have taken the time out of what I'm sure is very, very busy, chaotic days for you guys. But everyone has been very interested to hear this straight from you guys. And so we appreciate that very, very much, truly. And thank you to all of our sponsors for making this possible. Just echo what everybody has said, and just everybody stay safe and stay well and take this seriously. This is the only way we're going to get through this, right?
Great. Jennifer, Susan, Jeff, anything else before we go? It looks like I know. All right, everybody, have a great afternoon. Thanks for being here.
Thank you.
Thanks, everybody. Thanks, Joe.
Thank you.